That is booming in the midst of the coronavirus pandemic is telemedicine. The outbreak, of course, straining our healthcare system, but telemedicine is being seen as an ideal alternative, and it's as simple as using your cell phone or laptop. Our next guest has been advocating for same-location telehealth services to help COVID-19 patients while also protecting healthcare workers and conserving the oh-so-important personal protective equipment, or PPE. Let's bring in Kentucky Republican Congressman Andy Barr. Congressman, thank you for joining us this morning here. Tell us about
why.
why.
You, Emma.
Great. Tell us about why you are such an advocate for telemedicine.
Well, this is a great example of the effective public-private partnership that has come together to fight the COVID-19 pandemic here in the United States. As you were saying in the run-up to this interview, this has hit the world community very hard, but we are very lucky in the United States to have leading, cutting-edge, prominent epidemiologists, experts on the front lines fighting infectious disease. And right here in my district in central Kentucky, Lexington, Kentucky, Dr. Mark Dougherty, who is a prominent, very skilled epidemiologist and very innovative, came to me early in the pandemic and he said, you know, we can use FaceTime, an iPad, a Bluetooth stethoscope, telemedicine in the hospital. We can bring modern technology to the fight against this disease, help our patients. We can also protect healthcare workers and prevent all of them from being exposed while at the same time conserve critical personal protective equipment, the masks, the N95 respirators, gowns, and whatnot that it was very scarce early on in this pandemic, largely because of the weaponization of the supply chain by China. But we took Dr. Dougherty from the private sector. We took his innovative ideas to the government, both in Congress and to the Trump administration at the Centers for Medicare and Medicaid Services. And to their credit, CMS changed some of the reimbursement rules that allowed on-site, same-site, in-hospital telehealth services. And this was a nationwide policy change.
Yeah, it seems like, you know, you've made an impact in people's lives by doing this. Of course, it is kind of a different experience. You're used to going in person to your doctor's office, to having that conversation, to make sure that you are thoroughly checked out, to make sure everything's good to go. What have you heard from people who's actually used telemedicine in regards to having these checkups, in regards to the communication between their doctors? Is it easy to do so?
Well, there's a high level of satisfaction, I think, both on the part of the healthcare providers and on the part of the patient. Many patients, especially those who are vulnerable, older, or immunodeficient, they don't want to go to the clinic. They don't want to go to the doctor's office or the hospital under these circumstances. They prefer to stay at home if they have the technology and the broadband connectivity. We still have a challenge in rural America getting better connectivity. But in terms of certain procedures, they absolutely can use telemedicine to provide checkups and diagnoses. This technology is really innovative, and it's really come to the forefront in this pandemic and this healthcare crisis. But I think it's here to stay, and I think telemedicine, where appropriate and where it can be used, will be the wave of the future. Now, there are some procedures, obviously, orthopedic surgery, for example, any kind of surgical procedure, you need to have in-person treatment and care. But in many cases, especially in diagnostics and checkups, primary care, psychological care, a lot of things can be done remotely and through modern technology.
Okay, so even once we get past COVID-19, potentially this could be here to stay. We want to bring in Dr. John Dougherty, an infectious disease physician at Lexington Infectious Disease Consultants. Good to see you, doctor. Thank you for joining us. Tell us about your experience with telemedicine and your patients.
Well, first off, it's Mark Dougherty, but at any rate, I think one of the most enduring things that's going to happen out of this pandemic in terms of medicine is the transition to telehealth. We've been looking at telehealth for several years. We are a large referral practice, and we have patients that come oftentimes from 3 or more hours away, sometimes from out of state. That's 3 hours each way. It's a huge effort for them to get here. A lot of them are ill and have trouble traveling. A lot of them have limited resources. Of the one good thing that's come out of this pandemic, I think, is the transition to telemedicine. I think, the patients have embraced it, and I think it's saving a lot of time and energy on their part and on our part. Now, we realized early on in the pandemic that we were going to have critical shortages of personal protective equipment, especially the N95 masks and the gowns. Those are very important in terms of protecting healthcare workers from acquiring coronavirus from the patients. Most of those are manufactured in China, and we realized that resupply of these critically needed pieces of equipment would be very limited. When I looked at what happened early on in the pandemic in New York and in Washington, they just flat ran out of some of the N95s and the gowns, and healthcare workers were told to go into the room with a scarf over their face, which I found completely unacceptable. So we realized that we were going to need to conserve. And one of the ways that we realized that we were going to need to conserve was by using telemedicine in our own hospital. So we had been thinking of telemedicine primarily as being in the hospital, being in our office and communicating with the patient at home. But then we subsequently realized that as a PPE conservation effort, we were going to need to try to communicate and manage the patients outside of their rooms so that we wouldn't just burn through all of our PPE immediately. So we started using iPads and FaceTime to actually examine the patient with the help of the nurses, and using Bluetooth stethoscopes to listen to their lungs and their heart. And we found that we could really manage the patients quite well unless we needed to do a procedure on them outside of the room.
Yeah, well, that sounds like you're using technology effectively. Doctor, do you think this will continue post-COVID?
Well, I think in a situation where we're concerned about contagion and we don't have adequate personal protective equipment, it could. Through those measures that I mentioned, we were able to reduce use of personal protective equipment down to 20% of what we had before. Now, we had a couple of big hurdles in doing that. One was that resistance from some of the medical staff and the physicians because of the way we're trained. We're all trained to put our hands on the patient, press on their belly, examine the patient, be in personal contact with the patient. So that was one hurdle to get over. I had to talk to the other physicians and the staff and said, listen, if we're in and out of the rooms too often, we're going to deprive the rest of the staff of the critically needed personal protective equipment. And we just have to adopt a new way of doing things. The other hurdle that we faced was that had not been counted as a face-to-face encounter by Medicare, CMS, and other insurance companies. So that wasn't actually even counted as an encounter if you didn't go in the room and see the patient face-to-face and touch the patient. So I discussed this with Congressman Barr at length. He realized the importance of this in terms of a PPE conservation effort. And as far as I know, he was the only congressman to really approach CMS and push this through as a face-to-face encounter.
All right. Well, it's great to talk to both of you, seeing this teamwork really play out during this crisis. That's Kentucky Republican Congressman Andy Barr, Dr. Mark Dougherty, infectious diseases physician at Lexington Infectious Disease Consultants. Thank you both for coming on the program, and stay safe.